Ladies and gentlemen, welcome back to our next section of anxiety. Now I know what you're thinking. We're taking an exam that causes us to be anxious, and we're talking about anxiety, which with an exam is giving you anxiety. And the irony of having anxiety while you're talking about anxiety is making you anxious. But I don't want you to be anxious. You know why? Because you're here with me and MedQuest and the other team members, and you're gonna rock this test. So stop feeling anxious, put your book down, take a deep breath, and let's talk about anxiety disorders. Panic attack! Are you having a panic attack after all that? What is a panic attack? A panic attack is intense anxiety and feelings of dread and doom. Like Dr. Doom. Have you ever noticed there are so many villains who are doctors? Do you think they should have like a screening thing when they're handing out PhDs to say, do you plan to take over the world? I don't know. But a lot of them are going to have autonomic symptoms as well. They have to have at least 4 symptoms of autonomic hyperactivity. And they can be anything from diaphoresis, trembling, chest pain, fear of dying, chills, palpitations, shortness of breath, nausea, dizziness, paresthesia, disassociation symptoms. But in this setting, they're going to have all of these things. The most common is going to be chest pain and shortness of breath. The timeline, usually within 30 minutes of the onset of this anxiousness. Now, panic disorder is recurrent panic attacks. Now, on the exam, the patient's going to say to you, I had these symptoms, I had these feelings, I noticed this happened. I've had them multiple times. He's describing to you recurrent panic attacks and has panic disorder. But if a person is saying to you, I'm feeling anxious, I can't breathe, my chest hurts, the walls are caving in, they're having a panic attack. And remember, panic disorder is recurrent panic attacks with at least 1 month of persistent worry, but we're not sure what we're worried about. My worries have worries, right? My anxieties have anxieties. This was something that Charlie Brown said. And remember, the behavior change is going to happen. And these patients are going to try to change their behavior to avoid another attack because they feel like they're dying. But the behavior change is maladaptive. Some of them start drinking. Some of them use drugs. So the maladaptive behavior changes. It's actually more common epidemiologically in women. And the next step in management for these persons, again, it's a disorder. So you have to make sure that there's no underlying organic cause. So you're going to rule out thyroid disease, hypoglycemia, cardiac disease, pheochromocytoma. And then the treatment's going to be SSRIs and benzodiazepines. Now, how is this going to work? The way I want you to think about it is in the same way analogous to migraines. The SSRIs are going to be the prophylaxis to prevent future panic attacks. The benzodiazepines are the acute abortive medication like triptans for migraines. You're going to begin with both and then taper. And then you're going to ultimately stop the benzos because they have a potential for abuse. And then, of course, behavioral individual therapy is critical because this person has to understand what was it about that situation? What was it about the situations that was common, the common denominator? What is it driving in me? What anxiety is it unmasking that's causing this severe dread, doom, and autonomic symptoms? The most common psychiatric disorder in women of all ages, anxiety disorders. In men, anxiety symptoms are most commonly from what then? Substance-induced. So what's the first line treatment going to be for panic disorder? We said it before, it's SSRIs. In this case, it's sertraline. Now notice they put alprazolam there. When you're asked to choose for panic disorder, that means you want to handle all the panic attacks. You use the prophylactic or overarching treatment for chronic symptoms. Alprazolam is for panic attacks, unilateral, one-time, acute symptoms. Now, fitting into the anxiety component is also something known as phobias. So what's a phobia? Well, you know and I know that phobias are a fear of an object or a specific situation. The diagnosis, how is it made? The person's going to tell you, I'm deathly afraid of heights. I saw a spider and I ran across the street. There are people who have fear of all kinds of things, and where they come from and the underlying etiology of why the phobia develops is for a long couch and someone to listen to 3 times a week for an hour at a lot of money per hour. The timeline is going to be that the phobia must be present for at least 6 months, persistent and disabling. You might be like, oh yeah, no, I have a phobia. I've got a phobia of, onions. Is it disabling? Is it persistent? No, you just hate the taste. That's not a phobia. The phobias must make them unable to function when that thing is there. So a person who's freaking out on a plane has a phobia of flying. The person who's just like, I don't like flying because, it smells. No. And the treatment for this is going to be behavioral modification. Now let's go over the two types of phobias. First, there's specific phobia. Specific phobia means you have a fear of an object, an animal, heights, or cars. Social phobia means they have fears of specific situations, public restrooms, eating in public, or public speaking. It's going to involve situations in when other people may make you feel embarrassed. Now, do you know what the most common phobia is in the United States? The most common phobia overall. Is it spiders? Is it heights? Is it the Kardashians? No, it's public speaking. That means that a person would rather be in the casket than giving the eulogy if they have a fear of public speaking. Beta blockers are used in which phobia? Which ones will they help the most? Good. If you're saying stage fright or anxiety about performing, you're correct. And when is it given? 30 to 60 minutes before the performance. A 40-year-old man says he's been too shy. He has problems going to parties. He feels anxious about getting close to others, but he wants to. He stays at home in fear that others will laugh at him. He gets anxious and hyperventilates with increased sweating and diaphoresis when he's in social settings. What's the diagnosis here? The answer? Social anxiety. Now, one of my favorite TV shows was called Monk. It's about a person who had obsessive compulsive disorder. There's also a great movie by Jack Nicholson called As Good as It Gets, in which he portrays somebody quite well with obsessive compulsive disorder. And in obsessive compulsive disorder, what's going on is that this person has an obsession with something, right? Cleanliness, hand hygiene, locking the door, the car is closed, they forgot to do this. And so these obsessions of forgetting to lock the door or their hands are not clean causes severe internal anxiety. And so that anxiety is a noxious internal stimulant. It eats away at them. So then they think, how can I suppress this? So they come up with compulsions, which can be anything, for themselves, like locking 27 times, because I know that if I do it 27 times, it'll definitely be closed. Washing my hands 51 times with hot water and 21 times with this. And so they come up with these ritualistic behaviors to suppress that obsession and anxiety. Remember, it commonly occurs with patients who have Tourette's syndrome. When I was in psychiatry rotation as a medical student, we were in an outpatient part of the rotation, and the patient was someone who had OCD, obsessive compulsive disorder. And what her complaint was that she would get out of her home in the morning, get in her car, and then drive to work. And then she'd freak out that she left her door unlocked. So she'd drive home. And then she'd check and unlock the doors and relock them and then go to work. And she would go back and forth multiple times before she got to work and be consistently late, impairing her function. Now it's a disorder. And so the psychiatrist, in addition to her treatment plan, which involved what medication? SSRIs, gave her different types of therapy, one of which was exposure and response prevention. And what he told her to do, and this is in the days when smartphones were becoming like a thing, he says, I want you to take a picture of your locked door. And when you get the obsession, look at the picture, give yourself reassurance, and keep driving. And before you knew it, it worked. Brilliant, brilliant psychiatrist. Now, what are the features of OCD? Well, first of all, they're going to have some metabolic issues. They're going to have increased metabolism where in the brain? If you look at a functional MRI, the frontal lobe. And they're going to have a bigger what? Yeah, size matters here. They're going to have a caudate nucleus that's going to be increased in size compared to normal. Now, if you watched TLC, you know that there's a disorder called hoarding disorder. Now, you might laugh, but it's actually a big problem. These people have problems discarding possessions and things that you and I would consider useless, wasteful, garbage. And it takes over their home, their lives. It causes clutter. It impairs their functioning. It impairs the people that they live with, loved ones, and it causes a severe amount of anxiety for them. When you try to throw something out, they freak out. And so the treatment for this is going to be SSRIs, and then they definitely need behavioral modification techniques and cognitive behavioral therapy. Body dysmorphic disorder is when patients become obsessed with a specific body part that they themselves have figured out to be defective or misshapen, although everyone else thinks that they're totally fine. That obsession with their nose, usually it has to do with things in their face, and it impairs their ability to go out, have relationships, have confidence and self-esteem. And what they do is they spend their time in front of the mirror and now taking selfies. The treatment for these patients is going to be SSRIs combined with significant individual psychotherapy to get to the root of why it is that they believe something in their body is not correct. Remember, the most common place is on the face. Post-traumatic stress disorder and acute stress disorder are symptoms of reliving traumatic events of something that happened to the person after a big life stressor. And what you must remember is you must rule out specific things that go along with PTSD and ASD is going to be depression and substance abuse. The treatment here is going to be SSRIs, relaxation techniques, psychotherapy, and they get a lot of nightmares. And these nightmares need to be reduced. So how are you going to reduce the nightmares? Prazosin. But remember, timeline is extremely critical when it comes to somebody with either PTSD or ASD. Now, in post-traumatic stress disorder, the symptoms must last more than 1 month. For acute stress disorder, the symptoms last for more than 2 days and less than 1 month, but have to occur within 1 month of the traumatic event. Now, when you put all those other anxiety conditions aside, there is an anxiety condition just called generalized anxiety disorder. Why do we call it generalized anxiety disorder? Well, these people worry about everything. Everything. They're worried about everything. They're worried about things they shouldn't be worried about. They're worried about the fact that they're worried. They're worried about the fact that they're worried and nobody else is worried. And the anxiety is out of proportion to what they should be worried about that you and I wouldn't be worried about. And they're worried that you and I are not worried and they're still worried. You get the worry? And so what are the other symptoms? Well, they're going to have fatigue. I would be fatigued too if I was worried about everything. Concentration difficulties. Their concentration difficulties are like you trying to have a conversation while texting somebody on your phone. You know how damn hard that is? It's impossible. Like, I don't know what to do because you're trying to have a conversation with this person, but you got to respond to this person with a cute GIF and emoji because you're so adorable, and you start locking up. Multiply that by 1,000, and that's the concentration difficulties they have. They also have sleep problems because they're so anxious they can't sleep at night. That anxiety causes muscle tension and restlessness, most commonly in the neck, shoulders, and upper back. And epidemiologically, GAD is more common in women. So how are you going to treat them? Well, first-line treatment is still SSRIs. If the SSRIs don't work, then you can try venlafaxine or buspirone. However, when it comes to the SNRIs like venlafaxine, you have to caution the patient that they may feel an increase in the anxiety up front because of the norepinephrine, but eventually they'll stabilize out. And then of course they need psychotherapy and behavioral therapy because they have to understand what it is they're worrying about, why it is they're worrying about that they should try to change the way that they're worrying and not worry so much. You have a 35-year-old woman who reports palpitations, dizziness, and increased sweating for 8 months. She can't relax. She worries about everything. She worries about her parents' health even though they are healthy. Worries about finances, but she's got a sugar daddy. What's the diagnosis here? She's worried about worrying and worrying about everything. The answer? Generalized anxiety disorder. Start her on an SSRI, get her some therapy. Phobias, they'd have to tell you something specific caused the issue, like a dog or a cat or a spider. Panic disorder, they'd be describing those autonomic symptoms, but they wouldn't have anxiety about multiple things. It would be panic out of nowhere. Adjustment disorder, we're going to talk about that soon. Adjustment disorder is when you have trouble adjusting after a life stressor and develop symptoms of anxiety, depression, and a combination of things. And basically, adjustment disorder is you're just not hacking life right now. You're not doing well. And with therapy and help, you get better. And then social anxiety is a fear of being in social settings. So this actual vignette fits generalized anxiety disorder. And that's the end of our section. I hope that you are not as anxious anymore, that you're chilled out, because we're going to get to our next section, which is substance abuse, and I don't want anyone to try to do that if they're feeling anxious.